Welcome back to the Morning Blend. This month is Cataract Awareness Month. So what exactly are cataracts and how can people ensure they can see clearer longer? Well, here to answer these questions and more is ophthalmologist Dr. Raymond Theodosis with Shepherd Eye Center. He's joined by patient Caroline Kelly, who had her operation done with Shepherd Eye Center. It's great having both of you. Welcome in.
Thank you.
It's worth noting, by the way, I mean, when you go somewhere to get an operation done, you want to make sure that they're trusted. Shepherd Eye Center, you just celebrated 50 years in Las Vegas. That's incredible. Tell us about the center's history and how it's grown to where it is today.
Yeah, well, Dr. Shepherd opened his doors in 1968, so we're just past that 50-year mark now. He started as a solo practitioner. Over that time period, we're up to about 19 doctors, 5 different locations. Wow. So it's been a busy 50 years.
Absolutely. Well, there's a lot of eyes out there.
That's true.
And that's the thing. When you have a patient come in, it's two. You get 2 eyes for each patient. That's pretty good. Cataracts, I mean, this is a very common ailment in many eyes, and aging eyes, of course. What are some of the symptoms that people realize when they're starting to get cataracts in their eyes?
Yeah, they vary widely, but the overarching theme is that it results in a decrease in quality of vision. Yeah. So it can range from difficulty reading street signs when you're trying to drive, difficulty reading small print on medicine bottles, which seems to be a common complaint, to noticing differences in colors. Whites tend to get washed out, kind of turn brown or yellow, blues not as vibrant.
Yeah.
And then a common one is nighttime driving. Glare from bright headlights, things like that tend to give people problems.
It's like a dirty windshield on a car almost.
It is.
Tell us about your experience and what led you to walk through the doors of Shepherd.
Well, I was a quilter and bead maker, and I postponed the surgery for a little over a year because I was afraid I wasn't going to be able to thread the needle after that.
Oh, no kidding.
Well, no worry.
My goodness, really?
Yeah.
Which is great. Of course, you're like, you know what, let me tough this out for a little bit. Heaven forbid I'm unable to do this. That will take a big piece of me away.
Right.
But you go into Shepherd Eye Center. Tell us about what the experience was like for you.
The surgery itself, is that? Oh, well, it's only a 10-minute surgery.
No kidding?
Yeah.
Wow.
And no pain, no needles, no nothing, just a drop to anesthetize the eye, and you're surrounded by professionals. So it's a wonderful experience.
So you got that done, and it was so easy to the point where you're like, why did I wait a year?
That's right.
Here we go. The quilts you could have done them so much faster.
Yes, yes.
I mean, this is just an example, though, of how far the technology has come when it comes to doing operations like this, isn't it?
Yeah, the times of spending a week in the hospital with sandbags on the side of your head are thankfully over.
Yeah.
Typically, the surgery takes 10 or 15 minutes to perform. You're leaving the operating room with a pair of sunglasses. The worst part is having to use some eye drops for about 3 weeks. It's a fantastic surgery.
Yeah.
Good results.
Now, of course, when you're there and they're saying, this is going to be easy, it's going to be easy. Of course, in your head, you're probably saying, yeah, we'll see how easy it's going to be.
Yeah.
How nervous were you beforehand and how relieved were you afterwards and realized, wow, that really was nothing?
Well, yes, one is nervous before any kind of surgery.
Of course.
But as I say, there is nothing to it anymore.
Yeah.
Really.
Really, which is great. She's almost wants another cataract just to go in. So is this something where you get it done and you're good for life, or do you have to come back every few years?
Well, unfortunately, there's lots of other parts of the eye that can have other problems. So yeah, we do cataract surgery. The cataract is a one-time thing. Once we remove it, it doesn't come back.
But other parts of the eye may.
Other parts of the eye can have problems. So yeah, we still recommend coming back.
Of course. So if we suspect something, it might be a little bit amiss with our eyes, how do we get the ball rolling? How do we ask the difficult question and stop being scared or too proud to go in and say, you know what, something's amiss here?
Yeah, what I tell people is there's never a wrong reason to come in. Even if we look at you and say, gosh, you look fantastic, you have that peace of mind. The worst thing you can do is, think you have a problem, try to rationalize it, ask some friends and think, oh, maybe it's okay. I've seen too many people, unfortunately, that have had vision loss that's potentially irreversible at that point because they've decided to put it off. There's nothing more anxiety provoking than not knowing, so you should come in and figure it out.
Absolutely, and you can attest to that.
Absolutely.
I mean, this is the thing about independence, and you want to make sure that you're able to see clearly, not just for today and not maybe just for putting together a quilt, but for driving and doing your day-to-day stuff. What would you say to somebody that might be having trouble reading the bottom of the screen right now?
Go and have an eye exam.
There we go. That's very good.
Right.
Well, it's great having both of you. Congratulations on seeing. I'm sorry it's me that you have to see right now, but it'll be all right. Doctor, it's great having you.
Thank you. Appreciate it.
Thank you so much. Hey, Shepherd Eye Center. They have 5 locations throughout Southern Nevada. They've been serving the community for over 50 years. The website is shepherdeye.com, SHEPHERDI.com, or call 702-731-2088. I'm saying it just in case they can't see the screen. Shepherd Eye Center, a proud sponsor of the Morning